Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Farah Haaniya Nuriswarin. I'm from Faculty of Medicine and Health Science, Islamic State University of Maulana Malik Ibrahim Malang. And I would like to talk about hydrocele. Hydroceles are common cystic scrotal abnormalities. It is described as a fluid-filled collection around the testicles between the visceral and parietal layers of the tunica vaginalis of the scrotum. Yes, this is in the healthy testicle, and this is the hydrocele. The difference is in hydrocele there is accumulation of fluid, and in the healthy testicle there is no fluid in the scrotum. Okay, and hydrocele are caused by imbalance of scrotal fluid production and absorption, and the cause can be divided into two causes, that is exogenous and intrinsic. In exogenous, the fluid excesses are from abdominal cavity, and that usually occurs in communicating hydrocele, and the second is intrinsic. In intrinsic, the fluid excesses are from abnormal intrinsic scrotal fluid shifts, and this usually occurs on non-communicating hydrocele. And also, the hydroceles are caused by lymphatic system diseases such as filariasis. Okay, this is non-communicating hydrocele, and the fluid is just from the scrotum, inside the scrotum, and in the communicating hydrocele, the fluids are from the abdominal cavity or outside the scrotum that can enter the scrotum. It's like this. Okay, this is the pathophysiology. The first is in the non-communicating. In the non-communicating hydroceles, and it can caused by localized infection or trauma, and also can caused by previous varicocelectomy or inguinal surgery, and also can caused by testicular or scrotal malignancy. That all these three causes can cause impaired fluid drainage, and the impaired fluid drainage can cause the imbalance between the secretion and absorption of fluid in tunica vaginalis. And this imbalance of fluid in tunica vaginalis can cause the accumulation of fluid within tunica vaginalis. And then the second is in communicating hydroceles. It usually occurs in babies or in congenital patent processus vaginalis that can cause the communication between peritoneal cavity and the scrotum, and it makes the fluid flow into the tunica vaginalis. In the fluid is a flow from the peritoneal cavity or abdominal cavity. So it can also cause the accumulation of fluid within tunica vaginalis. So it's called hydrocele. Okay, and the next is the clinical findings. In the hydrocele, there is a scrotal swelling because, as I said before, that in the scrotum there's the accumulation of the fluid, so it makes the scrotal swelling, and this is painless. And to differentiate the hydrocele and also the another disease that can cause the the scrotal swelling, there is the examination just like this in trans illumination and fluctuation, and the trans illumination and fluctuation are positive in the hydrocele because in hydrocele there is contained the fluid that it makes the trans illumination and fluctuation as positive. Yeah, this is the differential diagnosis as before that can cause the swelling in the scrotum, just like hernia and also cystidicordia, that it can make the swelling in the scrotum. So to differentiate this disease with hydrocele, we can see in the hydrocele the resistance illumination is positive because it contains fluid. Okay, this is the macroscopic findings of the hydrocele. Yeah, there is a swelling in the scrotum. This is swelling in the scrotum. So this is the this is a macroscopic finding. And inside the scrotum there is fluid. Okay, the next is prevention. Okay, for the baby, there is nothing we can do to prevent the hydrocele, but in the adolescent or in adult, we can prevent it by keeping the testicle free of injury, because as I said before in the pathophysiology, that the hydrocele can cause by the injury of the testicle. Okay, the last I would like to uh, talk about the saying from Prophet Sallallahu Alaihi Wasallam, "Ma anzalallahu da'an illa anzalalahu shifaan." It means there is no disease that Allah has created except that He also has created its treatment. Okay, that's all for me. Thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.